Turmeric.
Please subscribe for more.
What is turmeric? Turmeric is a vibrant golden-orange spice derived from the rhizome, or root, of a native Asian plant, Curcuma longa, which is a relative of ginger. It has been used for hundreds of years in cooking, particularly in Indian, Southeast Asian, and Middle Eastern cuisines, and is a major ingredient in curry powder. Beyond its culinary uses, turmeric has a long history in traditional medicine systems like Ayurvedic and Chinese medicine. The active compounds in turmeric are called curcuminoids, with curcumin being the most well-known and extensively studied. Curcumin is responsible for turmeric's distinctive yellow color and is believed to possess many of its beneficial properties.
Here's a breakdown of the potential benefits of turmeric. 1. Anti-inflammatory properties. 2. Antioxidant powerhouse. 3. Brain health support. 4. Heart health. 5. Digestive health. Anti-inflammatory properties. Curcumin is a potent anti-inflammatory compound. It works by blocking molecules that trigger inflammation in the body. This can be beneficial for conditions associated with chronic inflammation, such as arthritis, including osteoarthritis and rheumatoid arthritis, heart disease, and metabolic syndrome. Some studies suggest it may be as effective as some over-the-counter anti-inflammatory medications.
Antioxidant powerhouse. Turmeric is rich in antioxidants, which help protect the body from damage caused by free radicals. Free radicals are unstable molecules that can contribute to aging and various diseases. Curcumin's chemical structure allows it to neutralize these harmful free radicals.
Brain health support. Boosts brain-derived neurotrophic factor, BDNF. Curcumin may increase levels of BDNF, a protein crucial for brain health, memory, and learning. Low BDNF levels are linked to brain disorders like Alzheimer's and depression. May improve memory and cognition. Some research indicates that curcumin may improve memory performance and protect the central nervous system from stress-related damage. Potential in Alzheimer's disease. While more research is needed, curcumin's anti-inflammatory and antioxidant effects, along with its potential to help clear amyloid plaques, a hallmark of Alzheimer's in the brain, suggest a role in managing or delaying the disease.
Heart health. Turmeric may contribute to heart health by reducing bad cholesterol, LDL, and triglycerides, preventing artery blockages, improving the function of the lining of blood vessels, reducing inflammation and oxidative stress, which are factors in heart disease. Digestive health. Relieves gastric issues. Turmeric can help soothe the digestive lining, reduce excessive acid production, and alleviate conditions like acid reflux and gastritis. Aids digestion. It can promote smoother digestion, reduce bloating, and help with conditions like irritable bowel syndrome, IBS. Immune system boost. Turmeric's antioxidants and antimicrobial properties can help strengthen the immune system, making the body more resilient against infections from bacteria, viruses, and fungi.
Blood sugar regulation. Some studies suggest that turmeric can help regulate blood sugar levels and improve insulin sensitivity, potentially reducing the risk of type 2 diabetes. Mood improvement. Curcumin may have antidepressant effects by boosting levels of mood-regulating neurotransmitters like serotonin and dopamine, and by reducing brain inflammation often linked to anxiety and depression. Joint pain relief. Due to its anti-inflammatory and analgesic properties, turmeric can help reduce swelling and pain in joints, making it beneficial for individuals with arthritis or general joint discomfort.
Skin health. With its anti-inflammatory and antibacterial properties, turmeric can help with conditions like acne by reducing inflammation, fighting acne-causing bacteria, and controlling excess oil production. It may also promote overall skin radiance. Liver support. Turmeric can enhance liver function and support the body's detoxification processes, potentially helping to prevent fatty liver disease.
Weight management. Turmeric may aid in weight management by boosting metabolism and reducing inflammation associated with obesity. Potential cancer benefits. While more research is needed, particularly in human studies, laboratory and animal studies suggest that curcumin may influence cancer growth and development by contributing to the death of cancer cells, reducing tumor growth, and preventing metastases.
Important considerations. Bioavailability. Curcumin is not easily absorbed by the body on its own. To enhance its absorption, it's often recommended to consume turmeric with black pepper, which contains piperine, increasing absorption by up to 2,000%, or with a fatty meal. Supplements versus spice. While incorporating turmeric into your diet through cooking is beneficial, to achieve the higher concentrations of curcumin used in many studies, supplements are often necessary. However, always consult a healthcare professional before starting any new supplement, especially if you have existing health conditions or are taking medications, as high doses can interact with certain drugs or cause side effects. Research limitations. While many benefits show promise, a lot of the research on turmeric, especially regarding serious conditions like cancer and Alzheimer's, has been conducted in lab or animal studies, and more large-scale human trials are needed to confirm these effects definitively. How to make turmeric tea. Turmeric tea can be made with either fresh turmeric root or ground turmeric powder. Adding black pepper is highly recommended to significantly increase the bioavailability or absorption of curcumin due to the compound piperine. Incorporating a healthy fat like coconut oil or ghee can also aid absorption as curcumin is fat-soluble.
Here's a basic recipe which can be customized. Ingredients: 1 cup water or milk for a golden milk latte, 1/2 to 1 teaspoon ground turmeric, or 1-inch piece of fresh turmeric root peeled and thinly sliced or grated, 1/4 to 1/2 teaspoon ground ginger, or 1/2-inch piece of fresh ginger root peeled and sliced or grated. Optional, but highly recommended for added flavor and benefits. A pinch of black pepper, essential for absorption. 1/2 teaspoon coconut oil or ghee, optional for absorption. Honey or maple syrup to taste, optional sweetener. Lemon wedge, optional for taste. Other optional additions: cinnamon stick or cardamom pods. Instructions: boil water or milk. Bring water or milk to a boil in a small saucepan. Add the ingredients. Add the turmeric, fresh or ground, ginger, if using, black pepper, and optional coconut oil or ghee to the boiling liquid. Simmer. Reduce the heat to low and simmer for 5 to 10 minutes, or up to 15 to 30 minutes for a stronger brew, especially with fresh roots. Strain, optional. If using fresh roots or whole spices, strain the tea into a mug. Sweeten and serve. Stir in honey or maple syrup and add a lemon wedge if desired.
Tips: fresh versus powdered. Fresh turmeric offers a more vibrant flavor, but ground turmeric is convenient. Don't forget the pepper. This is key for maximizing the benefits. Golden milk latte. For a creamy version, use milk, dairy or non-dairy, like almond or coconut milk, and simmer with the spices. Staining. Turmeric can stain surfaces, so be careful with your utensils and countertops.
Here's what research and common practice suggest regarding when and how to drink turmeric tea. Key absorption factors, more important than time of day. With black pepper, piperine, this is the most important factor. Piperine, a compound in black pepper, significantly enhances the bioavailability of curcumin by up to 2,000%. Always add a pinch of black pepper to your turmeric tea. With a healthy fat. Curcumin is fat-soluble. Consuming turmeric with a source of healthy fat, like coconut oil, ghee, or even in a golden milk made with full-fat milk, can further improve its absorption. With food, while you can drink it on an empty stomach, taking turmeric with a meal, especially one containing some fat, can help with absorption and also minimize potential stomach discomfort for some people. When to drink turmeric tea. Considerations for different times of day. Morning. Energy and focus. Many people enjoy turmeric tea in the morning as a warming, caffeine-free alternative to coffee. The potential brain-boosting and anti-inflammatory effects could help you start your day with more clarity and less stiffness. Digestive kickstart. It can help stimulate digestion and reduce morning bloating. Immune boost. Starting your day with an immune-supporting drink can be beneficial. Convenience. For many, the morning is simply the most convenient time to incorporate it into their routine.
Afternoon/midday. Post-lunch digestion. If you experience afternoon sluggishness or indigestion after lunch, a cup of turmeric tea can aid digestion. Inflammation management. If you have chronic inflammatory conditions, spreading your turmeric intake throughout the day might provide more consistent benefits. Evening or before bed. Relaxation and sleep. Since turmeric tea, without added caffeinated tea leaves, is naturally caffeine-free, it can be a soothing bedtime ritual. Its anti-inflammatory properties might help reduce pain or discomfort that could interfere with sleep. Overnight repair. The body does a lot of repair and detoxification overnight, and the anti-inflammatory and antioxidant properties of turmeric could support these processes. Avoid if prone to nighttime urination or stomach upset. If turmeric tends to upset your stomach or increase urination, avoid it right before bed.
Practical advice. Consistency is key. The benefits of turmeric are generally cumulative. Drinking turmeric tea regularly, rather than just occasionally, is more likely to yield noticeable results. Listen to your body. Pay attention to how you feel. If drinking it on an empty stomach causes discomfort, try having it with a meal. If it keeps you awake, switch to a morning or afternoon cup.
Choose your purpose. For joint pain or inflammation, consider dividing your intake throughout the day, or drinking it when you anticipate discomfort, for example, morning for morning stiffness, or evening for overnight relief. For digestion, drink it before or after meals. For general wellness or immune support, any time of day that fits your routine is good, ensuring proper absorption.
In summary, focus on how you prepare your turmeric tea, with black pepper and fat, rather than obsessing over the exact time of day. Choose a time that is convenient and allows you to be consistent with your intake for the best results.
Side effects.
While turmeric tea is generally safe and offers many health benefits, it's important to be aware of potential side effects, especially with high or concentrated doses, more common with supplements than with a typical tea. Here are the potential side effects of turmeric tea. 1. Gastrointestinal issues. 2. Blood thinning. 3. Gallbladder problems.
4. Low blood sugar, hypoglycemia. 5. Iron absorption interference. 6. Liver issues. 7. Allergic reactions. 8. Kidney stones. 9. Pregnancy and breastfeeding. 10. Interactions with other medications.
1. Gastrointestinal issues. Stomach upset. This is one of the most common side effects. Some people may experience nausea, stomach pain, or indigestion. Acid reflux. Turmeric can sometimes increase stomach acid production, which might worsen acid reflux symptoms in sensitive individuals. Diarrhea or constipation. While turmeric can aid digestion, excessive amounts can sometimes lead to changes in bowel habits. Bloating and gas. Some individuals might experience these symptoms. 2. Blood thinning. Turmeric has mild, natural blood-thinning properties. While this can be beneficial for some, it's a concern for others. Increased bleeding risk. If you have a bleeding disorder or are taking anticoagulants, blood-thinning medications like warfarin, aspirin, clopidogrel, Plavix, or ibuprofen, consuming significant amounts of turmeric could increase your risk of bruising and bleeding. It's crucial to consult your doctor in this case. Before surgery. Due to its blood-thinning effects, it's generally recommended to stop consuming turmeric, especially in concentrated forms, at least 2 weeks before any scheduled surgery to prevent excessive bleeding. 3. Gallbladder problems. Turmeric can stimulate bile production. While this is often helpful for digestion, if you have gallstones or bile duct obstruction, it could worsen the condition or trigger pain. Avoid if you have gallstones or bile duct obstruction. 4. Low blood sugar or hypoglycemia. Turmeric has been shown to lower blood sugar levels. Interactions with diabetes medications. If you are taking medications for diabetes, such as insulin or glyburide, consuming turmeric tea could cause your blood sugar to drop too low, leading to hypoglycemia. Symptoms include shakiness, dizziness, confusion, and rapid heartbeat. Monitor your blood sugar closely and consult your doctor.
5. Iron absorption interference. Some research suggests that turmeric, particularly in high doses, might interfere with the absorption of iron. Concern for iron deficiency or anemia, or are taking iron supplements. Discuss this with your doctor.
6. Liver issues. While turmeric is generally considered beneficial for liver health in moderate amounts, there have been rare reports of liver injury or toxicity, particularly with high doses of concentrated turmeric or curcumin supplements. Caution with pre-existing liver conditions. If you have any liver disease or dysfunction, such as hepatitis or cholestasis, consult your doctor before consuming turmeric tea regularly or in large quantities.
7. Allergic reactions. Although rare, some individuals can have an allergic reaction to turmeric, which may manifest as skin rashes, hives, itching, or swelling, especially around the face or mouth. Severe allergic reaction, anaphylaxis, can occur, characterized by difficulty breathing, wheezing, rapid heart rate, and dizziness. Seek immediate medical help if this happens.
8. Kidney stones. Turmeric contains oxalates, which can bind with calcium and contribute to the formation of kidney stones in susceptible individuals when consumed in very high amounts. Caution for those prone to kidney stones.
9. Pregnancy and breastfeeding. Turmeric, when used in small amounts as a spice in food, is generally considered safe during pregnancy. Avoid medicinal amounts. However, consuming larger medicinal amounts, like concentrated tea or supplements, is often advised against during pregnancy, as it might stimulate the uterus or induce menstruation, potentially posing a risk. Lack of data for breastfeeding. There isn't enough reliable information on the safety of medicinal amounts of turmeric during breastfeeding, so it's generally best to err on the side of caution.
10. Interactions with other medications. Beyond blood thinners and diabetes medications, turmeric can potentially interact with antacids, may increase stomach acid production, counteracting antacid effects. Blood pressure medications could potentially lower blood pressure too much. Chemotherapy drugs. Some studies suggest curcumin might reduce the effectiveness of certain chemotherapy drugs, while others suggest it could enhance effects. This is complex and requires strict medical guidance. Immunosuppressants, example, tacrolimus, may increase drug levels in the body, leading to increased side effects. Certain antidepressants, antibiotics, antihistamines, cardiac drugs, statins.
Important advice. Moderation is key. The side effects listed above are generally more associated with very high doses or concentrated supplements, rather than the typical amount of turmeric found in a cup or two of tea. Listen to your body. If you experience any adverse reactions, reduce your intake or discontinue use. Consult your doctor. Always speak to a healthcare professional before making significant changes to your diet, starting new supplements, or consuming turmeric tea regularly, especially if you have any pre-existing health conditions, are pregnant or breastfeeding, or are taking any medications. They can provide personalized advice based on your health status and medication regimen. Source quality. Ensure you are using high-quality, pure turmeric to avoid potential contamination with lead or other harmful substances sometimes found in poorly sourced spices.
Thank you for watching this video.